Vital signs are the foundation, they're the basics. I'm going to make a series of videos talking about vital signs. So if you're watching this video here, this is video number 1. If you've seen my other videos, this one will be the foundation for the rest. I'll discuss vital signs. It's going to be a little mini series here just to keep you all updated, and it's a basic thing that everyone needs to know and master well. Whether you're a doctor, nurse, physical therapist, anyone who's going to work with patients, especially in hospital settings. This is essential knowledge. It's here for free, no charge for you. So please help me out with a like and a share. If you can become a member, that helps me a lot. But without further ado, let's get started. First, there's a difference between vital signs and vital data. But before I talk about vital signs, I need you to understand that the foundation of vital signs is in what I'm going to show here. So, before we can really understand vital sign values, we need to understand what life is. And one thing you need to understand is what life is. So when we talk about what life is, it makes a lot of sense because we're talking about vital signs. Signs of life. So, I don't want you to watch this video just for me to tell you that systolic and diastolic blood pressure values are X and Y, heart rate 60 to 100, etc. Man, that's basic. You can find that in a book. I want to bring you something that will give you mastery over vital signs. So, when we talk about signs of life, what do I need to understand? That for us to be alive, we need to have blood pressure. And this blood pressure has a blood volume that I consider as cardiac output. And this cardiac output is made up of heart rate and stroke volume, as well as vascular resistance. But this here, guys, works to deliver what's essential for human life, which is oxygen and glucose. So let's grab a red marker here and write it down. So what does all of this do? It delivers oxygen and CHO. What is CHO? C6H12O6 glucose. So what are signs of life? For a person to be alive, they need to have enough pressure to deliver at least a minimum amount of oxygen and glucose so that the cells can generate energy in the form of ATP. And then the whole ATP energy thing will work really well. So that's basic. This is the bread and butter that we need to know. So what does blood pressure mean then? It's perfusion. It's the amount of blood that will reach all the extremities of a person's body, of a human being. So, from the moment I really understand this here, I'll really get it, and what vital signs are will make a lot of sense, right? It's not just the blood pressure reading, because I don't want to diagnose disease or hypertension. Forget about disease. So the goal here is for you to master the basics. So, let's go. Here we have volume being generated. Here is the volume from the left ventricle, which pumps blood to the whole body. So with each heartbeat, a stroke volume is ejected. Each beat, one stroke volume. Each beat, one stroke volume. We have around 70 beats generated by our sinus node. So we have 70 beats. And we have about 70 ml of blood ejected. So what do I have? Around 70 ml with each beat. So, if I have 70 beats in 1 minute and each beat pumps out 70 ml when I multiply this, 7 times 7 is 49. I add the 2 zeros. I have 4,900 ml. This is the cardiac output. This is the blood volume. This is the blood volume. So, look how cool. This is the blood volume. And what does the blood volume carry? It carries oxygen and glucose. So, when I have a reduction in blood volume, I have a reduction in the delivery of oxygen and in the delivery of glucose. So when I have reduced pressure, I have a reduction in energy. Because this here is going to form cellular energy, okay? So when I have an increase in blood pressure, I won't have an increase in energy, but I will have an increase in pressure, which can be harmful to the patient. Why? Because I have a little thing called vascular resistance. Just imagine this. The structure of a vessel, it has its layers, and those layers have resistance. So, if that resistance is weak, if it's bad, for example, it can rupture. So the pressure has to be balanced. So, if the pressure is too strong, it can rupture some part, And then we have the well-known hemorrhagic stroke happening somewhere, right? Which is spilling blood, an aneurysm, some kind of rupture. In other words, I can have a hemorrhage. So for us to really understand pressure, to understand vital signs, this right here, guys, is the main thing. So look, if you haven't studied this, take some time to study it, because it's no use just studying reference values. Because for reference values, I could teach you in less than 5 minutes, tell you all the reference values and the terminology for each one, and that's it. And that's not learning vital signs. If that's what you learned, sorry, you didn't learn anything about vital signs. Just a reference value and memorizing terminology, all right? So what does blood pressure have? It has a variation. Why? Because heart rate varies. Stroke volume varies, and vascular resistance varies. What does it have? Contraction and relaxation. In other words, it has elasticity. So these three here, look, they are variables. So blood pressure never has an exact value. It has a variable value. And that's why we study blood pressure like this. Look, systolic blood pressure and diastolic blood pressure. Then in an ICU, we work with mean arterial pressure. That would be the average between systole and diastole. So, for you to understand vital signs, you have to dive into this world I just talked about. So, if you already understood, great. And the systolic value, what would the systolic value be? Understand, I'm not talking about disease here. I'm not here to classify disease. Forget about disease. That's what people do. They want to learn vital signs by focusing on diseases. That's wrong. You don't learn that way. So, systolic blood pressure has a value from 90 to 139. And here, from 60 to 89, these are normal values for blood pressure. Now, when I classify disease, then we work with something else. I'm working here with the heart's workload values, working on vascular resistance without causing any mechanical or physical damage like a rupture, okay? So, this is the limit here, right? At the very end here, 140 over 90, let's say, rounding up a bit, would be the limit that wouldn't cause a rupture problem in the human body. From these values on, we can no longer guarantee that there won't be, or that it can't trigger a heart attack, a stroke, a pulmonary embolism, something of that magnitude, right? So, the first step is to understand this. If you understand this here, then you'll understand the classification of hypertension according to the latest guidelines. That's a whole different story. Here we're here to learn the basics so we can later learn pathology. All right, we'll stop here for now. I'll continue this lesson later. Lesson part 2, where I'll talk about heart rate. I'll see you next time.